Well, that's a wonderful closing comment, Gene, and suitable for a really wonderful panel that in many ways tied together so many of the themes of the day. It sets us up well for tomorrow. One of the things that occurred to me as I was listening to the speakers, including my colleague, former colleague John Lumpkin, was John and I worked together as colleagues in philanthropy at the Robert Wood Johnson Foundation. And one of the axioms in health philanthropy is that our obligation is to comfort the afflicted and afflict the comfortable. And what's very clear is that those who have achieved or still are at some comfort level in their profession are clearly already beginning to feel as if they're afflicted. And they're going to feel more as if they're afflicted if they're not responding to the changes involved or that are necessary. And yet we as a society are some distance from the training and education and financial capacity to make those changes that are necessary to help them adjust to the circumstances. And I think that those lessons came home very well throughout the conversation and lay the groundwork for not only what can be done here in North Carolina, in South Carolina, what probably is already being done at some level in Montana, and certainly for what we can do at the National Academy of Medicine. So thanks to each of you. Tomorrow we go now to a reception, and tomorrow morning we begin at 9 a.m. with the keynote from Karen DeSalvo, who also will be very integrative and inspiring in her comments. So again, thanks to all of you for the day and participation.